Hi.
Hello.
Laura, how are you?
I'm good. How are you? How was this morning?
Yeah, well, I went to see Keir Starmer's speech at the King's Fund, and what we were just discussing before we started this were there were three crucial reforms of how to fix the NHS. And during the notes that I made during the speech, I found two.
So did I.
And the notes that you've come up with have two as well, and we can't figure out what the third one is.
Yeah, so if you know what the third fundamental reform is, please let us know.
Yeah. So we've got moving from analog to digital, and we've got shifting care from hospitals to communities.
Yes.
If you know what number 3 is, we could ask Labour Press.
I feel like he should have told us when he said that there was going to be 3.
Should I? While we're talking about it, shall I text? Okay.
Yeah.
Do you want to give like a little brief overview of what was going on this morning?
Yeah, so Starmer's speech this morning was in response to a review by Lord Darzi into the state of the NHS, where he found a couple key issues, including that the health of the nation had deteriorated because of poor housing quality, low income and insecure employment. Also, there was reduced productivity in the NHS, increasing waiting times were normalised, there was a decline in cancer care, with the UK falling behind other OECD countries in diagnosis and survival, and also then, of course, the impact of austerity on the NHS. So what Keir Starmer was laying out in this speech was how they were going to address this, and interestingly, he said that they want to reform it, not reform the NHS, not just throw more money at it. They said that there will be no more money without reform. I'm not prepared to spend any more money on agency staff who cost £5,000 a shift, on appointment letters which arrive after the appointment, or on paying people to be stuck in hospitals because they can't get the care they need within the community. And then those 3, or possibly 2, fundamental reforms that we were talking about were how he was going to address this.
But we don't know what the third one is.
No.
We might find out before the end of this episode, and we'll update you. Yeah, so he said it's reform or die.
Yes.
And he says that the last line of the speech was, we could be the generation that reforms the NHS and gets it back on its feet. And that would be monumental. He said that, so Lord Darzi's report says that this is the most austere the NHS has ever been in since its creation, since since post-World War II, when buildings were commissioned. There's actually, not buildings were commissioned, sorry, recommissioned from the private hospitals that they were before into public ownership. Which is true because they're still Victorian buildings. And there was a really striking quote when he was talking about mental health. And he was talking about how there are people in mental health facilities who are in essentially Victorian cells with vermin on the floor, because there's no other facility for them. And if you remember how mental health was treated in this country during the Victorian, well, you won't remember, but if you know how mental health was treated in this country, you were locked up, you were imprisoned. So people are still in those facilities because there hasn't been anything new built, which I think is a very striking visual of the state that the NHS is in.
Yeah, and I think when you look at how much capital investment there is in the UK into our health service, it's much lower than other European nations as well. And I guess now we're seeing the payoff of not doing that. I thought it was quite interesting, the finding about how the health of the nation had deteriorated because of things like poor quality housing, low income and insecure employment, and how these reforms, I guess, are in part to address that, but won't actually solve the root cause, if the root cause is these kind of more systemic issues. What did you make of that?
Yeah, so life expectancy has stalled or even regressed in some groups. And they say that the King's Fund the King's Fund is where they were holding this conference today, where Keir Starmer spoke. They say, based on research from the Joseph Rowntree Foundation and a couple of other groups, that is because of poor housing. That's because of a decline in living standards. They also said that if you're poorer, you not only have, because you might have terrible housing, or you might have, you have poor life expectancy because of that, you also are less likely to access good services on the NHS. So I don't really understand the causal link there. But if you're from a more deprived background, you don't get good access to
I wonder
the
if,
NHS.
if deprived areas have more pressure on their local NHS services.
Well, do you know what, Laura? I think you've knocked that one out of the park. Yeah, I think it is that, actually, isn't it?
I thought something else that was interesting was when the talk about austerity and how austerities led us to where we are. And Wes Streeting was on the broadcast round this morning saying that the Conservatives had not just failed to fix the roof while the sun was shining, but effectively poured petrol in the house, turning the gas on, and then the pandemic lit the match. Just like an interesting metaphor.
It's nearly as good as the ship one.
That's what I was thinking about. I was like, Wes Streeting loves a metaphor.
Should we get that?
Yeah.
What is that Wes Streeting
Please do.
ship quote?
Isn't it about like being seaworthy?
It is about being seaworthy. Ship quote. Hang on. This is what? No, this is not okay because we've gone off. We've gone on tangent. Okay, are you ready? Mm-hmm. The only reason we have sails on the ship and the ship is ship shape is because Keir Starmer took the vessel from a shipwreck in 2019 and made it ship shape and seaworthy. Do you think that haunts him?
Yeah.
Do you think he's like, oh my God?
Yeah, I think his metaphor today was quite a bit better than that one.
I wonder what that is. Why does he love those so much?
I'm not sure. Excited to hear more from him.
I didn't get to ask a question today. The way that it works at these press conferences is that outlets are pre-selected and they are told when they turn up. And they actually had the press who were allowed to ask questions in an entirely different part of the room.
Oh, really?
The group of us that weren't allowed to were at the back. So I was in like the naughty press corner with like Times Radio and the Express. And yeah, so the question I would have asked though, he talks a lot about preventative healthcare, and the announcement on winter fuel payments would arguably work against any sort of preventative healthcare. I mean, in the report, it cites one of the issues being quote unquote bed blocking, because there isn't anywhere that people can go sometimes after they've had a long stay in hospital because social care is broken or adult social care is broken. And what we are probably going to see when you take away people's winter fuel payments, they might get sick and then they end up in hospital beds, which ergo they are bed blocking, but they've got nowhere else to go. So they're going to be stuck in hospital. And then that means if you want to go on to do routine operations, or people have got to go to a ward, and if there's no ward space, that operation doesn't happen.
Because he was speaking a lot about how they want to move from sickness to prevention, and it's something that you've spoken about in the podcast before, is how the NHS has become like a crisis service. Like the only time when you'll see someone face to face is when you're in crisis. And Keir Starmer was talking about how they wanted to introduce, well, he pointed to actually their plan to introduce being weighed in the office as a form of preventative healthcare, as well as you mentioned the smoking ban.
Can you imagine being weighed in the office? It's also like a fundamental misunderstanding of like the correlation between like weight and health.
Yeah.
Because you can be, like BMI, repeatedly now, we've had this discussion for going on a decade, that BMI is not an accurate way to measure someone's health. And you might be a quote unquote unhealthy BMI, but you're actually a very healthy person.
Yeah.
And then you might be bang where you should be and you're not. Very simple.
I think, what did you make of the talk or the touching upon reforming social care? And do you think they've actually set out a plan to do that and to integrate social care with health?
Well, I don't know, because that would require more money, wouldn't it? Because councils at the moment... Well, okay. Adult social care, a lot of that cost has been moved over to local government, right? And local government at the moment, one of their biggest expenditures is temporary accommodation. Some councils are spending up to 60% of their budget, which is insane, on housing people and temporary accommodation. I suppose if we're thinking, I don't know, how they could fund this, their argument would be, well, we're going to stop the boats, therefore we won't have any hotel charges, and we're also building new social houses, so we won't have to keep putting people up in hotels. Therefore, that'll free up some of the council's budget to fix social care. Maybe that's the 10-year plan that they're talking about. Did you notice that it was an 8-year plan this morning on the broadcast round? And then Keir Starmer at the speech said it was a 10-year plan.
Oh, why do you think that was?
I don't know, maybe someone did some maths and was like, whoa. We need a couple more years here. What do you think?
Well, they have a full 2 terms, so... yeah, I think it's interesting because in terms of spending, one of the things that the review found was that it wasn't necessarily that more money needed to be spent. It was the distribution of where it was spent. But one of the things they did point out as well was the budgets given to local authorities have decreased in real terms and they haven't kept up. So I guess that's something they'd need to ring fence as well.
But it's also the more responsibilities that have been piled onto local authorities. Because even when you think about schools, the funding allocation hasn't changed to schools, but what they're expected to provide and the services that they're expected to provide has expanded. And so a lot of schools are relying now on charities to keep their funding going. I mean, I know teacher friends of mine who work at, they essentially volunteer at their schools for some of their hours because they're paid a set amount of time and they have to volunteer the extra.
Do you think that, because Keir Starmer mentioned that they weren't going to raise taxes on working people to facilitate these reforms, do you think that taxes will have to rise, though, to facilitate these?
Well, I refer you to something Rory Stewart said this morning.
Okay.
Rory Stewart got himself into a bit of a muddle. He said that you will not fix the NHS without new taxes. And then he said, you won't prevent the privatisation of the NHS without new taxes. And then he said, no working person can pay more taxes. They should not have to pay more taxes. It was like, Rory, I think you found Starmer's conundrum.
I think that point about privatisation of the NHS is really interesting because in the Lord Darzi report, they point to the Lansley reforms at a certain point, which I think is interesting because this was like the very controversial changing of or introduction of choice and competition into the NHS. And Lansley suggested that it should be pretty much the only way to run the NHS. He framed this in a language of decentralisation, which isn't necessarily a bad thing, but really it was the commercialisation and marketisation of the NHS, meaning that just everything would be commissioned, basically like a commission-only service. But I think it's interesting to lay the blame solely with the Cameron era government because that introduction and the increasing role of the private sector was introduced under New Labour when the NHS started to shift from a service provider to a commissioning.
The PFIs, yeah.
And the introduction of PFIs as well. So it's not completely accurate telling of history, I think, to lay it solely with the Cameron government.
Lansley was hopeless and they're still feeling the effects of it today in the NHS. That's what Starmer said.
Really?
Yeah, he did. I mean, yeah, I suppose they are. One of the more obvious problems that you have with the NHS is to quote Starmer, is that it does work analog. It's not digitised at all. It's whenever you've been to the doctor has a pen and paper and then they have to input that that information onto a very old computer. And a lot of the time your documents do not match up. So one thing that Starmer was lamenting today was that if you've got a serious long-term illness and then you get moved doctors or you go to a different hospital or you get referred to another specialist, there's not an easy transfer of every medication you've ever had or every consultation you've ever had. You normally have to repeat yourself to the next person that you see. And that not only is really ineffective in terms of time, because if a consultant has got about 10 minutes to see you and you're wasting 7 of those minutes just basically catching them up, that's, an obscene waste of time. But you've also got the health outcomes out of that, which are going to be poorer because if you haven't got enough, if a doctor doesn't know that you've already tried like a certain medication 7 years ago and it didn't work and represcribes it, if you, the patient, don't remember or don't have an accurate record, well, you're wasting your time and you could deteriorate.
I think it's not been helped by the last government cracking down on pen pushers in the NHS, or what we call administrative staff, who did a lot.
What, in Scotland? What are the two different terms? They're pen pushers in England and administrative staff in Scotland.
But like they would have done a lot of that work that now I guess doctors are having to pick up. And in terms of the actual tech infrastructure that the NHS is using, there's lots of like anecdotal evidence from doctors that they're spending about 30 minutes of their day just like turning on and logging onto their computers because they're so old. And if you remember the malware attack on the NHS in 2017, one of the reasons for that was because they were operating on a Windows system that was over 15 years old and was no longer supported or updated by Microsoft.
Do you think that like the reason that the NHS doesn't get hacked more often is because people, it's like a morality issue for a hacker? They're like, it's so pathetic and weak that we're not going to do it.
Yeah.
Because even, I when you go and use, I spent quite a lot of time in a hospital earlier this year when my nonna was sick, and logging onto the NHS Wi-Fi, I was like, this is a risk. Because I was like, there's no way that this is encrypted. Anyone is going to be able to see like my data on here. I mean, not that I've got anything particularly shady.
I mean, Keir Starmer was talking up the NHS app during that speech as an example of what the NHS could be, and that app could be a whole digital front door to the NHS, and patients would be empowered because they would have their full medical record, which I guess is what you were touching on, saying that would be an improvement and quite helpful.
Yeah, it'd be good to be able to access all of your previous. Also, things like vaccines. It's actually very difficult to find out what vaccines you've had.
Incredibly difficult.
Yeah. Like I can't remember why I needed to prove that I'd had like, I can't remember what it was, like TB or polio or something like that, but I needed to prove it. And I actually phoned like my home doctors, like my mum's doctor, and they were like, we deleted you off the system because you hadn't been in. And I was like, right, okay.
Yeah, I think
I didn't die.
Yeah, I think it's very, especially if you're like moving between constituencies, it becomes like very hard to keep track of.
Yeah, absolutely.
I also think about if you are very sick and you're then having to compile your medical records and go through all this administration, it's probably the last thing that you need to be doing at that point. And especially if you don't have someone to, like if you're elderly or you are that ill and you don't have someone to kind of advocate on your behalf for doing it, it would become very difficult.
Sometimes the elderly are better because they actually write everything down.
That's true.
You know what I mean?
Yeah.
Like I'm thinking about my other nan, and she actually does write down lots of like things that she's had.
Yeah.
I would never think to do that.
It's a good idea.
Yeah. I mean, you had it like that. Oh, he was also talking about productivity. So he was saying that it's sort of record amount of money that is going into the NHS, and actually productivity is down, which is nonsensical. What I thought was really interesting about that was when he was talking about community healthcare, and a lot of that will rely on GPs and local GP surgeries to take on. So, you know, that they wanted GPs to be have more responsibility, essentially. The GPs that are in the BMA do not want that. They say that their workload is already unachievable and that they will not work later hours. There was one point being bandied about at one point in time that GPs would be open later to accommodate people who have to go to work. And it had to be pointed out by the union, like, are you going to pay us for that? Yeah. Or like, when am I going to see my children? Or like, you know, there's not enough GPs as it is. What do you think? There's going to be like a lot of doctor surgeries up and down the country have one GP in them and then a few nurses. That's insane.
It reminds me as well of like, did you watch This Is Going to Hurt when that came out?
Oh yeah.
And like how low the staffing levels were on the ward. And then it strikes you that happened, that was before austerity, that's set in about 2008. Or 2010. And then when you watch that and you're like, well, if that was how bad it is then, and they're telling us things have got significantly worse, you kind of just dread to think about it, don't you?
And in every single dramatisation of the NHS, there's always jokes about the computers.
Yeah.
Why don't they just buy a couple more computers?
I know, simple solution.
There's that girl on TikTok who's a doctor, and she's always going on about the computers.
Oh, I don't know who that is.
She says that like she goes and like sees a patient, and then she has like 15 minutes she's logging something on the computer, not because it's like a task, but because the equipment. I mean, I actually think that you might have been overgenerous, but when you said that during that malware attack they found that the Microsoft software was 15 years old, I reckon it's pre that.
It's like Windows 2000.
Yeah, no, I reckon we're going back before you were born. Like, I reckon.
Do you think?
It's definitely pre 9/11.
Okay.
Where there was a tangible vibe shift.
Yes.
But no change in or update in NHS software.
The third shift was from moving from sickness to prevention.
Sickness to prevention.
That was the third. Okay, I had that listed under point 2. Like I'd done that as 2C was moving from sickness to prevention. But I guess that's 3.
Okay. There doesn't really seem to be though like there doesn't seem to be sort of pragmatic or like, all right, so we've had this speech today. What's changing tomorrow?
Mm-hmm. And he was posed that question, I think, by, I can't remember which journalist it was, that asked him, you're saying this will take 10 years for these reforms.
Sophie
what would you tell
Hutchinson.
someone in a hospital today?
Yeah.
Mm-hmm.
Will they have to wait 10 years or something?
Mm-hmm.
That was Sophie from the Mirror.
Mm-hmm.
What did he say to that? He said like...
He said that we've been stuck in a cycle of short-term, like kind of sticking plasters. So this was the long-term plan. But then I guess the question remains, well, what are you going to do you need both. It's not a one or the other situation.
Yeah. What? Yes. What is the plan here, Keir? It does feel like the most sensible or the easiest. If you've got a real low, you haven't got enough staff at the moment, something that, and you've also got an economically inactive economy, or what do they say? Economically non-productive people or whatever they call it. Would it not be sensible to lift the tuition fees for all nursing for a couple of years? If you're over 30, like get people who want a career change, get them trained up. They could be on the ward within 2 years.
Didn't we once cost how much that would be? Because that was in Reform's manifesto.
It was.
I did the costings for it.
Yeah. That would make, you would get so many sign-ups for that. If it was free tuition and it was offered to people who were like as a postgraduate, like, you know, if you've got A-levels or a diploma or something, BTECs, come and do it.
Yeah.
We'd have too many nurses. It makes sense.
Yeah. And honestly, it's kind of surprising that doctors are still paying tuition in England. And
Doctors, I sort of get. I get why you would be paying tuition, because you can take that expertise, that gold standard medical training, and you can go and work anywhere in the world, or you can work in private healthcare or nurses, and the salary is high. You know, that you've got in terms of where you can go with that salary. There's not really a ceiling. Whereas for nurses, it's, you know, you're on, well, quite average pay for a good 10 years before you start progressing. Yeah. Also, you've got I mean, I know you have it with the doctor as well, but you've also got the most unfavourable hours. You can't start nursing and have children if you don't have a partner at home or childcare.
yeah, I think the junior doctors, though, say that when they add up their hours, they're often getting paid below minimum wage.
Yeah.
And also, I guess there is like a situation where like free tuition, but with the obligation to work in the NHS for 5 years or
I don't know if that includes training though, because I do know when you start out in teaching as well, the first year that you do it, you get a bursary, but it does mean that you are working below minimum wage for most of that year, but that's because you're training.
Yeah.
I don't know if that applies to junior doctors.
I'm not sure either.
I mean, we don't pay them enough. I mean, that's quite obvious, isn't it? Isn't it like £15 an hour?
Yeah, I think so. Something like that.
I think the reason that I find it so uncomfortable is I just remember that advert the BMA took out.
Which advert?
Like when they were going on strike the first time, and they were like, a junior doctor was paid the same as a prep barista. Are you comfortable with this? And it was like, what?
Stop pitting worker against worker.
Do you know what I mean?
Yeah.
It was so unsavoury. It was like, oh, I didn't realise that you were that special.
Yeah.
Like, oh.
Yeah, it's interesting, like the BMA's history as a trade union, because I think we don't, like, it is a trade union, but you don't often think of it as one. And they're also, like, I guess they would have more power than, I don't know if you would agree, they would have more power than other trade unions.
Yes, because they can, if they withdraw their service, there's real life there's real life consequences to anyone pulling their work. But if you're not providing healthcare or operations, it's pretty calamitous for a government, isn't it?
Yeah.
A train strike, you can kind of get by.
Yeah. I guess the consequences for the government would be more. Yeah.
Yeah. I loved when Rishi Sunak kept going on and on about the 9 million waiting list being a result of like the couple of strikes that had happened. It was like, how many people how many operations do you think they do a day? Like, what do you think is going on in there? Like, Anyway, anything else you want to add?
No, that's everything.
But we got the final point, didn't we? About how they're going to reform.
Yes, we did. Moving from sickness to prevention.
I think that what Labour should have done today, rather than pit this as sort of like this is the beginning of the end of chaos in the NHS, they should have just presented Lord Darzi's findings about where we are in the NHS and then said that we'll announce policies in due course.
Yeah.
Because there's nothing here.
I guess a lot of people on the broadcast round, actually, it was being put to them, isn't this really quick? Like, the review itself took only 9 weeks, and then they've immediately come out with a response to that review. So people were saying, isn't that a bit rushed?
Well, I suppose this review is sort of organic in that the NHS, all of the findings, everyone already knew. There's not one member of the public who hasn't been touched in some way by the problems with the NHS.
Yeah.
You'd be look, don't get me wrong. There are innumerable brilliant experiences with the NHS, and it's definitely when someone's in crisis mode. I mean, when you think about, you talk to anyone who's received cancer treatment or, been on dialysis, and what they'll talk to you about is not the pain that they went through. They'll start with the nurses on the ward were extraordinary. The doctor that I saw, he was unbelievable. That's what they say first, right? The people in the NHS are exceptional. They're gold standard, but the facilities have deteriorated. And the problem is that for far too long, the government have been able to get away with relying on the doctors and nurses' good graces and their good efforts of essentially working almost on a war footing for quite some time. You think about some of the equipment that they use. Sometimes you'll go in and my mum had quite a terrible, she had to get a lump removed from her face. And I remember going in for the first scan with her, and it honestly looked like a photocopier that was scanning her. And then she got referred, luckily, to a different hospital, and it was so high tech.
Yeah.
It's so luck of the draw.
Yeah.
You know?
Don't think it's it's a postcode lottery, I guess.
It is a postcode lottery, absolutely. And I think when you're fortunate enough to live around a big city where there are a few hospitals that you can go to or be referred to, then you're lucky. But then there are experiences in the NHS, like if you're, I can't say that actually, it's going to inquiry.
Oh.
Tay off. That's all I have to say. Do you have anything else to say?
That's everything.
Right, thanks for having us.
See you next time.
Bye.